Hello, everyone, and welcome to the Becker's Health IT and Digital Health Spotlight. I'm really excited to be interviewing today Dr. Michael Hasselberg, who's the Chief Digital Health Officer at University of Rochester Medical Center. Dr. Hasselberg will also be speaking with us at our Health IT Digital Health Revenue Cycle event in October. So we're really excited to have him here today, previewing some of the cool things that they're doing at University of Rochester Medical Center, and then talking about his perspective on the future. So to get us kicked off here, Dr. Hasselberg, can you tell us a little bit more about the most successful project or initiative that you've had from the last year? What did you do and what were the results?
Well, first, thanks for having me, Laura. It's good to be back on your show. Those of you who know me also know that I'm a nurse, and so the most exciting thing that's recently happened actually happened a few weeks ago during Nurses Week. And so at the University of Rochester, we hosted a virtual nursing hackathon to really start working with our frontline nurses to think about what does the future of nursing look like in the world of AI and a technology-driven workflow. And it was a great event. It was co-hosted between our innovation team with our nursing practice, our nursing informaticists, and also our School of Nursing. So can't wait to dig in a little bit further about that event with you, Laura.
Oh, absolutely. And that sounds amazing. Now, a nurse hackathon, I don't know if I've heard any other organizations really do hackathons focus on nursing. Can you tell us a little bit of the details there? How did that work? And, what was participation like? Were the nurses excited? Were they a little bit nervous in the beginning? Tell us about it.
Oh, the nurses were really excited. We had over 100 uh, participants, and over 80 of those participants were frontline nurses. It was hosted over in our School of Nursing, which is a very tech-driven, forward-thinking nursing school, which has a beautiful sim center. And so, in the sim center, we brought in some technology of the future. We brought in some virtual nursing equipment, but we also put in some computer vision and AI simulations. We had our nurses go to the sim rooms, play with the technology, see the technology. We did some demonstrations, and then we broke our nurses up into tables. We interwove into those tables some disruptors. So we had data scientists, we had computer engineers, we had ethics faculty at those tables, and we essentially challenged the nurses to say, hey, think of the most pressing problems that you have on your units. Where do you think technology may help support you to solve those problems? And if you had unlimited budget, unlimited resources, what would the future look like? And the winning team, what they won was the ability for us to start building out their use case to redefine our virtual nursing 2.0 strategy. And so it was so much fun, a lot of excitement. And we really also started to break down some of the fears that nurses have that around artificial intelligence and where it's instead of replacing the nurse's role, where could it support and it was a lot of fun.
That sounds like an amazing resource, especially for nurses who are just kind of dipping their toe into AI and trying to understand truly how it could impact the healthcare space, clinical care, their operations, but then too their relationship with patients and that experience. It seems like an amazing opportunity to really be candid and connect with those frontline nurses. I know you mentioned many things in there, and one of the things you talked about was um, some of these technologies around computer vision, which I know is very forward thinking. What were they most excited about? What really got them, thinking truly in a visionary, futuristic way about what's possible?
Yeah, so when I think of the future of nursing, and I'm a nurse, I have a faculty appointment in our data science department, so I've been dabbling with AI for quite some time. When I think about the potential of AI reducing the administrative burden, reducing the documentation burden of nurses, I actually don't think of what a lot of people are talking about these days, ambient documentation. I'm also a nurse practitioner, and as a provider, ambient documentation that's been rolled out across this country in health systems has been a game changer. But the use of language ambient AI for nursing, it doesn't really fit nicely. And I can delve into that in a second. Where I see the future of how can we relieve some of that documentation burden, it's going to be from the cameras and the sensors that we already have in the room that are essentially intelligently watching what's happening in that room, and helping do that documentation. And so, we were able to introduce what generative computer vision may look like in the future. And the nurses that are within our health system were quite jazzed of thinking about, where this could really take off some of that. I'm sitting behind a computer and typing and allowing them to actually get right back to the bedside again.
That's amazing to hear, and really, really cool insights into what the future may bring. Now, I know there's a lot of big ideas that come with kind of thinking through this and being innovative, but when you look at the next 12 months or so, how are you building upon that success of this initial event, and how do you expect your teams and role to change as a result of this technology and this new approach to innovation?
Twofold. So, really partnering closely with our nursing school. And I've talked about this before in other podcasts. What makes Rochester really special is we're one of the few academic health systems in the country that is fully integrated with our parent university. And so our nursing school is essentially generating the next workforce for our hospitals and in our clinics. And as I said at the beginning of this episode, they have a beautiful simulation center. And so our thought was, what if we mocked up exactly what the med surg rooms look like in our hospitals and the ICU rooms look like in our hospitals, and let's replicate those rooms over in the nursing school. Let's bring in all of the new technology. We'll bring in vendors and we'll do head-to-head demos. We will integrate the AI into our instance of our EHR over at the nursing school. And this will allow two things that happen. This will allow our nurses from our hospitals to come across the street over to the nursing school and play with this technology, help us innovate and think through of what are the right workflows for this technology before we ever go live and turn it on in the hospital setting. But it also allows our nursing students to start to learn and also think through with those floor nurses, what does the future of nursing look like? So when they graduate, they know how to use this technology and come right into our health system, well prepared for it. The other really cool thing is, our nursing students are going through simulations all day long over in the nursing school. And, with their consent, we get recordings of those simulations so they can learn, but we can also potentially use the recordings of those simulations with our data science team to start building out some of those computer vision models to actually, again, help support care over on the hospital side. So the next 12 months is going to be really aligning the nursing school with the health system, really aligning the technology together, and then starting to develop that literacy and that curriculum of how to interact with that technology.
Well, that's amazing to hear. And certainly that focus on the nursing school and the next generation of nurses, in addition to your current workforce and those who have already made a huge and meaningful impact on the organization, it seems just really smart in looking at the future. And I'm curious too, on the technology and data scientist side, what's it like working with them and bringing them into the fold to connect with clinicians and really get a deeper understanding of what clinicians need at the bedside and in their normal workflows. I can imagine that's not typically what data scientists, when they go to school and learn, what their IT background is. It's a different skill set to then jump in and understand and connect with these nurses and see the healthcare setting in action.
Yeah, and those of us as clinicians, we didn't go to school to become data scientists or computer engineers. Again, one of the really special things is our innovation team. We have engineers and data scientists and business students and faculty sitting side by side with our clinicians from our medical school, our dental school, and our nursing school who are our clinicians out there on the front end. And it's really within that diverse thought process that we learn from each other. Our clinicians are really starting to understand, what AI is, what is the importance of having clean data sets and why we need to spend all that work up front mapping the data before we can apply this algorithm to it. And our data scientists are really starting to understand what are the problems that our clinicians are facing as they're out there delivering care. And what we try to do is when we get early wins on the clinical side, one of the first groups that we celebrate that with is our technologists, our data scientists, and our engineers. And we're saying it's because of this pilot or it's because of this technology that you built that we saved this life or we improved this life or we created this efficiency and be able to celebrate together, really I think drives that momentum to truly innovate and disrupt. And so, we intermix our technologists and our clinicians together.
That's amazing to hear. And what a powerful story to tell, knowing that, no matter what side you're on, you're contributing to saving lives and really truly improving the health of the community. So I love that. Before we wrap up here, I wanted to ask, given everything we've talked about today, what do you think will be possible in 3 to 5 years that isn't right now because of technology?
Yeah, and let's stay on this nursing theme. AI today is very different than AI of 3 years ago. There's a lot of hype that we've been hearing around AI. A lot of folks jumping into this space. It's almost like you can't do a podcast episode or have a conversation without saying the word AI. But there is significant reality behind that hype. And, we're already seeing that disruption happen with ambient language documentation for our providers. And we're hearing stories across the country of providers saying, I'm going to work another 10 years because I have access to this technology. When I think about our nurses and I think about, what the future is going to be for them, I think of a world where a nurse is going to go into that room and check that wound, pull the dressing up, and there's going to be a camera in that room that's assessing that wound, and it's going to do that documentation. I see a mixed multimodal AI situation where there is a patient coding, and you have the nurses and the physicians coming into that hospital room, and they're yelling out, this is what I'm doing, this is the order that I'm doing it, and the ambient language is capturing a lot of that data, but you also have the computer vision and the cameras, filling in the gaps and also capturing what's happening in that room. And so after that patient live is saved, the clinicians can then move on to the next patient and don't have to worry about remembering all the things I did during that crash scenario, make sure it was all documented correctly. That is going to happen sooner than later. And, as folks get more comfortable with AI and as health systems and hospitals continue to invest in that technology infrastructure for things like virtual nursing, that future will be here really soon where that documentation burden is now off the shoulders of our clinicians and they can do what they really wanted to do and what they went to school for is actually doing that hands-on care and developing those therapeutic relationships with those that they're caring for.
What a beautiful picture of the future of healthcare delivery. Dr. Hasselberg, thank you so much for being on the line with me today. I really appreciate it. I learned so much and I'm grateful that you were here. So thank you.
It's always my pleasure. I've really enjoyed it, Laura. Thanks for having me.